We had been working on teen pregnancy for 30 years in Pueblo. Really, the first 25, nothing happened. And part of the problem was I don't think people were willing to acknowledge that it is a much broader effort than just A or B. It needed to be this global effort. What helped us in the Triple Aim is Triple Aim brings that global effort together. So how do you reduce teen pregnancy 40% in 6 years in a community that is 50% Catholic, that has a fairly active evangelical base, but also has some significant healthcare entities that provide women's health services? How do you do that? You respect each other's point of view. We have a group that comes together on a monthly basis. One group is very much clinically oriented. They're all about long-term, long-acting contraceptives. You have a part of the community that doesn't believe in those. But they believe in mentoring. They believe in youth. They believe in creating positive youth development. So how do you bridge that gap? The common ground is we care about kids. And you know what? We've got groups on this particular committee that sits and talks about teen pregnancy. We have Catholic groups who cannot even talk about birth control. And when we have those conversations, we validate them by saying, we understand you can't talk about this, and that's okay. And we're fine with that. And for the folks in the clinical world, youth mentoring is not something they do. They don't get it. And so they validate that by saying, this is not something we do. We don't do this clinically. But you guys do this really, really well. And you can build positive relationships with the youth in our community. You can make sure that our youth have an active place to go where there's great adult interaction, that you have role models and places that they can have interaction that's safe places for them to go. And whether it's faith-based or not faith-based, doesn't really matter. And it took time. It took time to build trust amongst those groups. But they still sit together, and they still are able to have those conversations. Yes, the people who are clinical and do the long-term contraception do the long-term contraception. Yes, the people who do youth mentoring and faith-based youth mentoring, they do that. But they're able to share. And the nice thing about what we do at Pueblo Triple Aim is we take the data from both and say, these work together. It's not one or the other. It is both that has reduced the teen pregnancy rate in this community. We need the youth mentoring programs. We can validate them. We can validate their work and say, yes, you have had an impact. We can take the clinical side, the long-term contraception, and say, yes, we can validate that. But what's nice about us as a neutral entity and what makes the Triple Aim so beautiful is it's a neutral place where it all comes together to say, this has benefited the community in the long run. That's what we've done.